Sunlight's golden gift. When too much vitamin D turns toxic. The sunshine vitamin has become a household name, with its critical role in maintaining optimal health. Vitamin D regulates calcium absorption, supports immune function, and influences brain health. But as the saying goes, too much of a good thing can be bad. Let's delve into the potential pitfalls of excessive vitamin D intake. The sunshine shortage and supplements. Despite being abundant in sunlight and certain foods like egg yolks, fatty fish, mushrooms, and tuna, 1 billion people worldwide still face vitamin D deficiency. https://www.financialexpress.com/life/vitamin D deficiency. Sedentary lifestyles and poor dietary habits contribute to this growing concern. A lack of vitamin D can impact bone health, mood, productivity, and susceptibility to seasonal illnesses. As awareness grows, so does the temptation to self-medicate with over-the-counter supplements. But beware, an overdose of vitamin D can unleash a cascade of health complications, and this is where things get controversial. The Goldilocks zone of vitamin D, finding the right balance is crucial. The tolerable upper intake level, UL for vitamin D, is set at 4,000 IU, 100 micrograms daily. Exceeding this limit, particularly with 10,000 IU daily, can result in vitamin D toxicity, characterized by elevated blood calcium levels. Accidental overdoses often occur due to improper dosing or prescription errors, not typically from dietary intake or sun exposure. Decoding vitamin D toxicity. According to Dr. Akhilesh Yadav, Director of Orthopedics Joint Replacement at Max Super Specialty Hospital, Vaishali, vitamin D toxicity, known medically as hypervitaminosis D, happens when your body absorbs excessive vitamin D, usually from supplements. This leads to hypercalcemia, a dangerous condition where your blood calcium levels soar, potentially harming your kidneys, bones, and heart. Symptoms of vitamin D overload. The effects of excessive vitamin D can vary widely. Mild symptoms include nausea, vomiting, increased urination, and fatigue. However, severe cases may involve kidney damage, calcium deposits in organs, and cardiovascular issues. Contrary to popular belief, too much vitamin D can actually weaken bones instead of fortifying them. Missteps in vitamin D consumption. A common pitfall is taking high-dose supplements without medical supervision or monitoring. Dr. Yadav cautions against assuming that higher doses equate to better health. Ignoring natural sources and relying solely on pills for vitamin D can lead to an imbalance, especially when combined with calcium supplementation without regular testing. Sunlit breakfasts for healthy vitamin D levels. While sunlight remains the best natural source of vitamin D, incorporating certain breakfast foods can help manage your intake. Fortified orange juice, milk, and cereals offer convenient options. Some exposed egg yolks and mushrooms provide natural sources, as do oily fish, like salmon and mackerel, for non-vegetarians. Consistently including these foods in your diet can maintain adequate vitamin D levels without resorting to excessive supplementation. In conclusion, while vitamin D is essential for health, it's important to approach its intake with caution. Remember, the goal is not to eliminate, but to balance. Too little or too much can both lead to adverse outcomes. Stay tuned for more insights, and feel free to share your thoughts on this topic in the comments below.